Next up, to unpack some of the issues and items that were discussed by the Minister, I'd like to introduce the Chief Executives of our local health districts, Sonia Marshall from South Western Sydney, Lee Gregory from Nepean Blue Mountains, and Alison Derrett from Western Sydney. Please welcome to the stage. We might start with Minister Park's comments around improving efficiencies and services, patient experiences, particularly in our EDs over the past 12 months. What are you guys seeing on the ground in terms of some of the investment and reform that's happened over the past 12 months? Sonia?
I can jump in and start there. Liverpool Hospital has been fortunate to be one of the 2 sites in the first rollout of the safe staffing in the emergency department. So we're just nearly at the point where we have been able to recruit all those 35 additional nurses for Liverpool Emergency Department, and that is actually going to make a difference to patient care. And we start the rollout to both Campbelltown and Bankstown a little later in the year. What the additional staff means is that patients who are actually in our emergency departments get seen and get treatment. So it's not an insubstantial change that people will experience in our EDs. That, together with our ED short stay investments, and Campbelltown Hospital was one of the lucky recipients of additional funded beds for their paediatric short stay, which will enable them, with their large growing paediatric community, to be able to safely transition paediatric patients through the ED and ensure that they're being treated and cared for in an appropriate space.
Lee?
Yeah, I think similar to Sonia, I think with the redevelopment at Nepean and the ED short stay we've got has made a massive difference, I think, in terms of where we flow patients through the hospital. And I think we're also trying to do that up at some other hospitals as well. I think the ED concierge program has been a great success as well in terms of just the communication to patients where they are and their journey, etc. I think that's made a massive difference as well.
Alison?
Thanks, Adam. Look, it's amazing to be here today. It's an honour and a privilege to actually be representing Western Sydney Local Health District. Like Lee and Sonia, we have also access to the concierge positions and our safe staffing levels. We have got some amazing ED staff. They do amazing work every day. And as you heard from Minister Park, we have some of the busiest EDs in the state, upwards of 200, 250 people coming in every day. That's a lot of people. And for me, it's about getting the treatment in the right place to the right person at the right time. And sometimes the ED isn't the best place to provide that care, and sometimes that place is actually in the home, thinking about how we partner with our non-government organisations, how we partner with our HIF and In Touch services that we have in the community to bring care to where people are sitting and are in situ. Because let's face it, not many people actually want to be in hospital. They want to be at home, surrounded by people that they know and love, and so really it's getting care, right place, right person, right time, and our services are wrapping around that as well.
Thanks, guys. I mentioned to the Minister the issues around heat and sustainability, and Lee, I suppose Penrith's a little bit more unique compared to some of your counterparts in terms of the issues it has to grapple with, both floods, fires and heat. What are you seeing locally, and what's sort of the health district's role in being able to mitigate against some of those issues, and how's it dealing with some of the things that are turning up at your doorstep?
I mean, Nepean Blue Mountains is a bit different and unique. The fire and floods makes it quite a unique district, I think. I think, we see the impact of that. The normal patterns of what you'd see attending your hospital are probably traditionally what you would see are different now because, simply because of the more extreme weather, I think. And that's something we have to adapt to as a local health district. And I think some of the work we do with the PHN on, the sort of disaster recovery, counter disaster work, etc., probably is one of the ways we're starting to adapt to those things and think about those things in the long term. But we do have to think in our service planning and take account of those different changes in demand as a result of the heat and the more extreme weather that we're undoubtedly seeing now in the community.
Yeah, Sonia.
Yes, I guess both Wingecarribee and Wallandilly local council areas both likely experienced the floods and bushfires through the 2018-19 year and ongoing. And I think it's the partnerships with the local councils and the planning that we need to do with our local councils and communities to ensure that we are creating spaces that help people be healthier. Driving out here today, I am from the Illawarra, so driving out here along the Northern Road, seeing all the redevelopment between, Picton, Wilton, and then right through the Northern Road there. What you see is, 5-10 years ago, where there was lots of farms and trees, now there's lots of redevelopment areas and the trees are going missing. So working really closely with planning to ensure that people have green spaces, to have tree canopy, to reduce some of that heat load for our communities, to make it healthier for them and make it easier for them to be healthier.
You make a good point there around making it easier for communities to make healthier decisions. Part of that, and it was a point that the Minister made, was around communications, and he used the example of that number, which many people weren't aware of. What work is happening, and we saw a lot of it happen post-COVID and during COVID, around communications, particularly in Western Sydney with Kool communities, Indigenous communities and other specific cultural groups. Can you talk us through sort of the work that's happening at that level in terms of being able to engage effectively with some of those communities?
I guess last year I stepped into the CE role for the event, and it was my first event as the acting CE. And I think at the time I said one of the greatest learnings that we took out of COVID was that we cannot treat any of our communities that we serve the same. We cannot use a cookie cutter approach to engage with our communities, particularly in the areas that we all serve, because of the diversity. And that diversity is not just in our cold communities, but it's in our socioeconomic demographics as well. And so being able to genuinely engage with key leaders and influencers in those cultural and linguistic groups and religious groups, to be able to hear from them about what they actually need for us to do to better engage them. Because no two groups are the same. What works with our Arabic-speaking communities do not actually work with our Vietnamese. So we have to be agile enough to be able to change the way in which we partner with and communicate with those communities. And therein lies some of the challenges that we in the Greater West experience that are magnified compared to our colleagues in the East.
Yeah. There are a bunch of questions that have come through, so I'm probably not going to get a chance to get through all of them in the next 18 minutes, but I will try. I'll start with the ones that are getting the most likes on my screen. LHDs are not just hospitals. What are some of the strategies or programs outside of those buildings that you think people might not be aware of? Alison?
It's really correct. We're not just hospitals, and there is so much work out there. We can't do things. If it's left to the health service to do it on their own, we can't do it. So we have to work in partnership, and we have to work closely and communicate closely. There is a range of things that we do in Western Sydney that increase that. So we've got, I'm thinking about the heat component that we were just talking about. We've tackled that from a number of perspectives: a population health perspective, where we're out talking to people around health needs, talking to non-government organisations, and working with councils around their planning remit, because we need to influence in that way. We've worked with, at the other end, where we actually had a heat symposium last year with our clinical leaders, that we brought people in from all over Western Sydney to work collaboratively around how heat impacts health and health conditions every day. In terms of one of our key services, which is our In Touch service, which is a community-based service. Part of their job is actually to knit services together for people in the community, and they do that by being in contact with not only services that we provide, but services that the PHN or GPs provide, services that our non-government and private industry provide, because health is not necessarily the answer to everything, but the way in which we work in partnership actually creates that wraparound care for people in the community.
Thanks, Alison. Another popular question, and one I'm sure you've all got an answer for. What attention, if any, is being given to preventative health, given how many health issues facing the region are preventable diseases? Lee, you want to have a crack at that one?
Yeah, I think I think it reflects the recognition that, Helen and Alison's just mentioned, healthcare is not all about hospitals, it's around the recognition I think we've seen in the last 10, 20 years around the more holistic view of health and the social determinants of health and keeping people out of hospital and healthy, as opposed to, traditionally you deal with the person when they arrive at hospital and they're not well, as opposed to early intervention. And I think some of the programs we've got, and we have in partnership with the PHN, around people who are repeated, their health means they repeatedly present to the emergency department. We have a number of programs to early intervene and keep them, wrap services around them and keep them in home. I think there's a whole range of programs like that for different types of cohorts of population that we work on with the PHN. But I think they're the types of things, those out of hospital care, early intervention, keep people, like Alison said, nobody wants to come to hospital, keep them in home well, and address some of those social determinants of health. I think some of the key things we need to be doing.
Alison and Sonia, I know you guys have both done a lot of work with the Peninsula Mountains as well around diabetes being one of those issues. Do you want to talk through that a little bit?
Happy to kick off the conversation there because as both Alison and Lee were saying, preventative healthcare is not just a health problem. It's a whole of community issue, because some of the largest contributors to poor health in all three of our districts are the fact that all three of our districts actually have the highest smoking rates in New South Wales. We have the 3 highest obesity rates in New South Wales. Our populations that we serve don't eat or eat the least amount of fresh fruit and vegetables in New South Wales. These are the big contributors to why we see increasing presentations to our emergency department. So it's a whole of system approach, and that is some of the work that we've done with diabetes is partnering with, for example, our Pacifica community, because their whole belief system is built around the celebration, and food is a large part of that. So partnering with them about making healthier choices and how to do that in a sustainable way when they come together to celebrate after their religious services on the weekend has been paying real dividends in helping reduce the rate of diabetes and them as a community being healthier. But that's one small community. We need to be doing more collectively, and that is a whole of community emphasis that we need to be having.
And I think, Adam, I was actually chatting with one of our senior cardiologists yesterday around how we link virtual care into, or virtual options or tools into how we care for our community in a preventative way. And she has received some amazing feedback from our community around how the use of worn devices, or the way in which we can build algorithms to remind people or warn people or support people in some of those healthier lifestyle changes. And so I think the options and the I guess the future around using some of those technologies to support our community. Our communities are big users of those sorts of technologies, as I guess most communities are, but have really embraced some of the programs, and particularly embraced some of the programs when they know it's linked with organisations that have got good reputations, Westmead Hospital, Blacktown Hospital, that they know that that's clinician linked, and so behind some of those, or behind all of those virtual care options, there's strong clinician engagement, and that really has made people engage and work within those virtual technologies.
On the issue of technologies, the Minister touched on AI, and obviously there's going to be new technologies that emerge over the coming years affecting that model of care. What's, over the past sort of 12 to 24 months, the community's response to some of those changes in care, particularly knowing that, in some of your districts, we're dealing with a lot of people from non-English speaking backgrounds. Is the take up there, are we seeing some changes that have occurred over the past couple of years?
Look, I'll start. Absolutely. I think as we sort of heard from Minister Park this morning, COVID has actually given us that ability to move into some of those technology enhanced areas. I think the thing and the lessons for me is that it is actually a tool and an enabler. It is not necessarily the service. And so what the link is actually to link a clinician, clinician engagement and clinicians around that. From a community perspective, we've found as long as it's culturally appropriate and we've thought through access to data and those sorts of things, absolutely people engage with it. I don't know how you found it.
Yeah, no, I think that same. I think people generally, enjoy. If you think traditionally you've got an outpatient appointment to the hospital, you've actually physically got to go in. There's models now where that can be done virtually. We all lead busy lives, and that's really well received. But I think key thing we need, to remember with all these models is two things. One, digital literacy of our population. Not all our population is digitally literate. I know in the NHS they see it as a social determinant of health, being digitally literate. And then just make sure that these models remove the friction. It's got to be a seamless, easy experience for people, and you do that, you'll get the uptake, I think. But generally, it's been really well received, some of those models I've seen.
Yeah. Sonia?
If I'm honest, it's patchy. And it's patchy because of the communities that we serve. So in Southwest, the community of Fairfield has double the amount of social disadvantage than any other area in New South Wales. So they struggle. They're also the most culturally diverse area in New South Wales. So the way in which we engage with that community needs to be very, very different than how we engage down the other end of the district in Bowral or Campbelltown. So it really depends.
Yeah. Definitely not a one-size-fits-all. I'm going to try and crack on with some of these other questions that have come through. What future challenges do you expect Western Sydney to face over the next decade? And how are you planning to address those proactively? Anything on the horizon we need to be mindful of?
Look, I think our precincts have a large part to play in that because, as I've already said, health is a whole of community issue, and we need to be doing this as a engaged community. So we need to be looking at ensuring that those who live in our communities have gainful employment. We need to ensure that we're supporting our LGAs with planning so that they are healthy communities that make it easier for people to be healthier in, and that they're supporting us with the messaging. We really need to be working with all of our partners and a number in the room here today to be able to ensure that we're all on message for the creating healthier communities, because that is actually the only sustainable way moving forward, is us all working together to ensure that we are building the health of our communities, because it's not just a health role.
Yeah. Alison?
Absolutely agree with Sonia. Workforce. So we'll be opening a brand new hospital in the next couple of years at Rouse Hill. That is from scratch. So if you think about all the sorts of professions that we need to build and be present in that hospital, that is a great opportunity, but also creates a risk for us in terms of being able to attract and retain a workforce, so that we need to do that. We've done a lot of investment in workforce over the last couple of years, and we've been able to see some success in retention, but we really need to think about that. And as we all open new services across Western Sydney, is how do we work collaboratively so we're not competing for the same pool, but that we can actually think about how we can build on each other's strengths and attract the right workforce.
Lee?
Yeah, I think from a health perspective, I think for me it's probably those, how do we integrate the system to address, like the one system ethos for the health system, and then start to look towards that focus towards social determinants of health, out of hospital care, and the resilience of our communities. Now that we address all those health inequalities that we see that end up with people in hospital, I think that's probably the key challenge I see for the system. It's really that integration, so we've got a one health system that works seamlessly for patients across all settings.
Picking up on Sonia's point around precincts, one thing that probably really haven't touched on today is the work, the exciting work that's happening across all of those health precincts across Western Sydney. Obviously, we know a lot about Westmead, Nepean, the Quarter, we've got Liverpool, Campbelltown, Bankstown potentially down the track. What are you seeing from a research perspective around the opportunities that are going to start to emerge around some of those places, particularly in your area, Sonia, where it's probably not as formed as Westmead, but we're now starting to see that, and with LIP, Liverpool Innovation Precinct, and CHEP, that connection with enterprise and research to form not just places that can make people healthier, but also drive research as well. What are some of the things that are happening in those spaces?
Good question, because 18 months ago, before I stepped into the acting CE role, I didn't have any understanding why the CE would be involved in these meetings that took up a large amount of her time.
I think we're to blame for some of those too, so I apologise.
But it's because that we need to be working with our community to ensure that we have got the right innovation, the right research occurring with our key partners to build the future of the communities that we want. So for the Liverpool Innovation Precinct and our partners there, it really is around capturing that innovation, that automation in healthcare, and being able to build on what we hope will be delivered once the Aerotropolis and the airport comes online, and being the closest point to where people will fly into the country to be able to try new kits in terms of health technologies. That's really where we see our future there. And with the partnerships with our universities, TAFE and secondary schools, ensuring that we've actually built the capacity of our community to be able to embrace that and be part of that innovation. We want to be seen as the place to be for the med tech of the future.
Got a question here, and I'm mindful that the Minister's sitting right in front of you, so you need to be careful how you answer it. But Mark Latham says we need a new hospital in the Aerotropolis at the intersection of 3 LHDs, and I'm obviously aware that the government's got a business case ongoing with that. Is Mark right or wrong? Do we need a hospital at the Aerotropolis?
So South Western Sydney has the privilege of doing the planning for the health services for the Greater Western Sydney Parkland area. Now, I want to say health service because that will involve looking at where we need to put integrated community health hubs, which will be important components to deliver both care that can be provided outside of a hospital, virtual services, but also that preventative, bringing together that preventative healthcare needs for our communities. So we're looking for areas that service all 3 LHDs, not necessarily a spot for a future hospital, but we need to be looking at what's actually required. So we're doing a 15 to 20 year planning piece that will ensure that we can identify the areas that will need integrated community health hubs with the potential of land being able to expand for what that might look like in the future.
Great answer. One final one, I think an important one, because I think we hear too many stories of it happening. Interested to get your response at the ground of what's happening within these EDs, but what are you doing in response to the violence and aggression that's occurring across EDs and the issues that are increasingly being faced by ED staff?
Look, that's a really scary one, Adam, because unfortunately it's a reflection of some of our communities, and that then comes into our emergency departments, that violence and aggression. So trying to support our staff with ensuring that they've got the right training. having security available, being able to ensure that when there is an incident that we're able to quickly provide both a hot and a cold debrief for our staff, supporting staff with leave when they need it post incidents, because it is a real issue that we all face in our emergency departments. But unfortunately, it's not just our emergency departments that we see that. So we really do need to be supporting all of our health staff in that way, because it's a challenging environment with those community expectations, but obviously the aggression and violence that they experience on a daily basis.
Yeah.
Yeah, I think it's a really tough one as well, because we cannot tolerate having our staff exposed to those sorts of situations. But hospitals are high emotive environments. Difficult things occur in those environments, and people are unwell. That's not to say people also don't behave badly as well. It's it's the complex issue. So it's about building, I guess, the systems, the training, the processes to wrap around our teams, but it's a really important wellbeing piece. So in terms of keeping our staff healthy and well is how we also look after them in an environment that can sometimes be a bit tough as well.
And just it's only a simple thing, but the ED concierge program, that's waiting rooms are calm, because people often just not having the information about what's next. Just having those concierges in the EDs made a difference as well in terms of keeping people informed and therefore calmer in a time of great stress.
Yeah. I can see the timer going. We've got 50 seconds left, so I'm going to throw one final one at you to give a 15-second response each. What is at the top of your wish list? How can this room full of health leaders support you to deliver better care for the community? It's an easy one.
I'll kick off. I think, and Minister Park picked up on it in terms of the impact that aged care is having on all of our acute facilities. Have conversations with your loved ones and with your family and friends about advanced care planning and end-of-life planning, because once you get into our facilities and once your loved ones get into our facilities, it's too late. So have those conversations now.
Excellent. Lee?
Yeah, maybe some things same as the Minister. Some of the things around primary care, aged care, and some of those structural reforms that we need that impact on our hospitals.
Great. And Alison?
I'll just say 3 words: partnerships, partnerships, partnerships. We can't do anything in isolation.
Brilliant. That's an excellent note to go out on. Thank you, Alison, Lee and Sonia. Certainly a lot of impressive and hard work that's happening within our LHDs. Ladies and gentlemen, please thank them.